My name is Erin Westfall, and I came to Mankato in 2006 to start a family medicine residency here at East Ridge Clinic in Mankato. I stayed there for a few years and then started practicing family medicine in Le Sueur for about 4 years until I came back to Mankato to work for the University of Minnesota, a family medicine residency program. So now I train 15 medical residents how to be family doctors. Well, I'm a physician, and I think that a lot of people don't understand that gender issues still exist in medicine. And in the not too distant past, one of my colleagues was asked during an interview, why would we want to hire you? We know that women physicians tend to have babies and go part-time. And in fact, just this last week, I was working in the hospital, and after I had introduced myself and discussed a management plan, the patient, in all earnestness, asked, when's the doctor going to be in? And you know, these are things that women physicians deal with on a regular basis. And yet, I recognize that as a straight white woman, I do have privilege. And a lot of that privilege has come from organizations like the YWCA and the work that they've done to empower women. And I recognize that women of color and sexual minorities sometimes don't have the same voice that I have. And through the work that I do, I'm trying to help to bring a voice to identify those issues of racism and inequity, and to try to find simple solutions to that, to use my voice to bring other people's voices into the forefront, to allow women of color and sexual minorities to have a voice, and as a white woman to speak up and to use my voice to influence my colleagues and to teach the residents as well. And it's not easy, and there's still a lot of work to be done. But I hope that through my work, I can use my voice to affect positive change. I see myself as needing to serve. I think that as a physician, I have a great responsibility to not only my patients, but to my community. And my job is to ask, what does our community need? And to develop those relationships and to help address whatever those needs are. On a daily basis, I see the effect of racism and systemic inequities on the health of my patients. And I see that on an individual basis when my patients can't afford medications or don't have a refrigerator to store their insulin in. And I see that on a community basis when we can look by zip code and see that someone that lives in one neighborhood lives 10 years longer than someone that lives right around the corner. I would tell anyone that's interested in leadership that you're a leader despite whatever your titles are. You can be a leader or not, and that you can informally lead and drive social change without needing the titles or the money that goes along with it. And that leadership is hard and tricky and it's messy and it doesn't always go well. But as long as you're willing to show up and ask questions and to do the work, the good work will get done.